Welcome, everyone. My thesis title is Treatment-Related Cardiotoxicity in Pediatric Oncology. My name is Nóra Beke. I'm a PhD student. My vision is that encourage the attitude that clinical practice and research are inseparable. And my mission is that cancer patients should live high-quality life without any complication. My first project title is Comparing the Diagnostic Tools Accuracy for Early Detection of Cardiac Failure in Pediatric Oncology. This will be a systematic review and meta-analysis. Although the 5-year overall survival of children with cancer is 80%, we pay a heavy price for it because of the serious cardiotoxic side effect of the treatment. Cardiovascular diseases are the leading cause of late morbidity and mortality. Childhood cancer survivors have 5 to 15-fold increased risk for heart failure, and almost half of the patients have myocardial injury. Current guidelines suggest echocardiography for monitoring, but in many cases it does not detect early enough. Otherwise, we know several other screening modalities, for example, other imaging technique, blood biomarker, genetic variants, and microRNA, but so far there is no study that compares their accuracy. Therefore, our study aim is to find out which modality is the most accurate in detection of cardiotoxicity, and if we succeed, we can make a recommendation for which tool should be used in order to minimize cardiotoxic side effects. It is an important topic because early detection allows us immediate interventions so we can save lives. Our clinical question is, what is the most accurate prognostic tool for predicting therapy-related cardiotoxicity in childhood cancer patients? We use PFO framework. The population is children with cancer and childhood cancer survivors. The prognostic factors are cardiac biomarkers, echo, genetic variants, and microRNA. And the outcome is the prediction accuracy of heart failure. Our hypothesis is that echocardiography is the most accurate prognostic tool in predicting therapy-related cardiotoxicity in childhood cancer patients. My search key contains 3 domains. The hit numbers can be found at the top of the slide. After the systematic search, I had 5,000 articles, and at the end of the all selection phases, I have 73 eligible articles. Based on the type of the predictive factors, we divided the articles into 5 major groups: microRNA, echocardiography, AI models, serum biomarkers, and genetic variants. The outcome is these factors' prediction performance measured by area under the curve, correlation, odds ratio, adjusted odds ratio, and mean difference. In this first forest plot, we have summarized some predictive factors, and in this case, they are investigated in a complex prediction model built by AI. We have plotted the time-independent performances of these following models. We used area under the curve as a unit, which shows the quality of prognosticability of these prediction models. The area under the curve is a region under the receiver operating characteristics curve, which shows that as we change the threshold of the underlying continuous variable, the sensitivity and specificity also change. The value can be varied between 0.5 and 1. 1 represents the maximum sensitivity and specificity, and 0.5 represents the result of random guessing. The figure shows that the performances are quite scattered. We used 3 cohort studies, and the heterogeneity here arises from the differences in the prediction models. We used the state-of-the-art values. The overall AUC values is 0.8, but we can see that ECG with clinical parameter reads 0.89 AUC value, which is an exceptionally high value. This suggests that clinical parameters alone are not enough. Additional examinations are definitely needed, and even then we cannot reach outstandingly good performance. In the next forest plot, we can see the prediction performance of high-sensitivity cardiac troponin T and some microRNA. In this case, we couldn't pull the results because statistically it was not possible. The time means that how many hours after the chemotherapy they checked the microRNA level. We used area under the curve as a unit, and we used 2 cohort studies. One of them defined cardiotoxicity based on troponin level, and one of them based on global longitudinal strain. Regarding the results, the performances are quite high. They can reach up to 0.9 AUC value, which is an exceptionally high value. This suggests that microRNA could be a promising predictive factor, but further studies and larger sample size are needed to prove it. Our study main strength that we try to create order in a chaos caused by a non-uniform publication strategy of the articles. This will be a complex and comprehensive analysis, most of the predictive factors we have known so far. And the main limitations are incomplete data provision and the differences in the definitions and variables. That's why we couldn't pull the results in most of the cases. Our conclusion is that detection of cardiac failure in pediatric oncology can be achieved with AI prediction models. The main implication for practice that AI models and microRNA should be used in diagnostics, and the implication for research that appropriate control groups are required, and the multivariate AI-based model should be a new way to improve detection of cardiotoxicity. Currently, we make a final adjustments before the internal review. And my second project title is investigating the side effect of tyrosine kinase inhibitor in pediatric cancer patients. This will be a systematic review and meta-analysis. One of the most promising groups in targeted therapy are tyrosine kinase inhibitor. These drugs work by blocking tyrosine kinase enzymes, so they affect gene transcription and DNA synthesis. Patients often receive them for years. That's why very important to know what their long-term side effect profile. The major groups of side effects, what they can cause are cardiotoxicity, hepatotoxicity, endocrinopathies, and growth retardation. But so far, there is no comprehensive study about these long-term effects. Therefore, our study aim is to provide evidence what side effects can be expected in the long term. Our clinical question is, what are the long-term side effects of tyrosine kinase inhibitor in pediatric oncology patients? We use PICO framework. The population is pediatric cancer patients. The intervention group is chemotherapy with tyrosine kinase inhibitor. The comparison group is chemotherapy without tyrosine kinase inhibitor, and the outcome will be the side effects. Our hypothesis is that the use of tyrosine kinase inhibitor during chemotherapy does not increase the risk for hepatotoxicity, cardiotoxicity, and endocrinopathy in pediatric cancer patients. Our study clinical implication is give better disease outcome for the patients, provide evidence regarding its long-term effect, and the clinicians could make preventive intervention in time. My preliminary research care contained 3 domains: pediatric cancer and tyrosine kinase inhibitor. The hit numbers can be found at the bottom of the slide. Since my vision is that pediatric cancer patients should live high-quality life without any complication, I would like to support this with my 2 studies. I would like to end my presentation with the words of Ralph Waldo Emerson: all is a riddle, and Cato riddle is another riddle. Thank you for your attention.
So congrats on your nice presentation. My question is about your second project, actually. Is there any data on the side effects of the tyrosine kinase inhibitors in adults, and do we expect different type or side effects in children than in adults?
I think the side effects is similar in pediatric cancer patients and adult cancer patients.
Also, with regard to your second project, like treatment with tyrosine kinase inhibitors and without tyrosine kinase inhibitors, would there be any difference in survival? Like, side effects are very important, but can the specialists afford using the non-tyrosine kinase inhibitor treatments?
Thank you for your question. I think we will examine this aspect of the topic, but so far I don't have time to dig into the second project.